In this video, I'm going to discuss pain and rehab and whether avoiding it or leaning into it optimizes outcomes. I'm Dr. Joe Camerato of the Cross Continuum. My goal is to help you be a better strength coach as a physical therapist. As physical therapists, we're surrounded by pain. A large chunk of our job, if not all of our job, is to assess somebody who has concerns about their pain and figure out a way forward. We learn a lot about pain in school and also not nearly enough about pain. Considering we still don't have a great understanding of what pain is, it's understandable that we don't learn or know everything that we need to know to manage it. If you want to better understand all things training in rehab, make sure to subscribe to my channel so you don't miss any videos. As a physical therapist, it's easy to get sucked into focusing on only pain in the clinic or in your patients' lives, trying everything you can to avoid making it worse while trying to make it better. What I'm going to be talking about today is a bit of an oxymoron or a contradiction, meaning that pushing into pain in an exercise context can actually help more than avoiding it. When you think of moderate to high intensity exercise, pain is nearly always in the conversation. In fact, because exercise occurs while you and your patients are alive, it would actually be weird if it wasn't in the equation. But many people, physical therapists included, feel that it most certainly shouldn't be present, not only during physical activity, but at all. I like to think of pain during training almost as an occupational hazard of sorts. I mean, the point of physical activity is to stress you and your body, and while applying stressors, finding points of intolerance is natural. That's how we create greater tolerances and find things that aren't tolerated well enough. The problem comes when you start to associate pain or symptoms in physical activity with a need to halt all physical activity out of fear of something being broken or breaking, so to speak. One of the mantras that I teach in our course on strength training is that hurt doesn't equal harm. There can be tissue abnormalities without symptoms being present at all, just as there can be symptoms present without any tissue abnormalities too. So when pain or symptoms rear their ugly head during training, fighting the reflex to fear the worst is a superpower that you need to develop. So which is better? An exercise program done with the rehab intention with pain or without it? If we look at studies that specifically tell their test groups to either perform the program with pain or without pain, we actually see that they do just about the same in regard to pain and symptom modification. The important difference they need to consider is that the group that is instructed to perform the program totally avoiding pain is usually doing so by drastically decreasing program intensity or volume. On the other side of this coin, the group told to exercise with tolerable amounts of symptoms we're just doing more activity in general. And if there's one thing that we know about physical activity, it's that there is a dose-dependent response, meaning that with higher intensity and higher volume, there are better strength and hypertrophy outcomes. Now, there are caveats to this, and I've discussed this in the past, so be sure to watch my other videos specifically on things like proximity to failure. So the big question here is, if you can gain similar rehabilitation outcomes, both cueing patients to exercise with and without pain, but one group experiences greater health benefits than the other, which would you choose? Now, if you're ready to embrace a strength-forward physical therapy way of life, pain or no pain, make sure to watch my other videos detailing how to write programs, how to manage athletes, and how to be a better strength coach as a physical therapist. And as always, if you found this helpful, please share it with your coworkers and your physical therapy friends, and I appreciate it.